So I'm going to, oh, it started to record now. So yeah, right. So we'll start the meeting, and if it is being recorded now, I'm sorry that we are actually late. I think all the members and officers realise that there's been some technical problems, but I'm David Acton, and I'm chair of this committee. And I'd like to welcome all members and officers to this meeting of the Pandemic Scrutiny Committee. Please remember to mute your mic when you're not speaking, and use the raise hand feature when you wish to speak. We have two main items on the agenda tonight. One is public health and adult care, and I think there are three sort of parts to that, and reports have been sent to all members. And the other is the Ofsted update, and again, members have received a report on those items. So if we go on to the agenda itself, attendances, we have three apologies: councillors New, Shaw and Blackburn, and I know that the executive member for health and wellbeing and equalities will join the meeting later. She has work commitments and will be here at 5. So in that respect, I intend to change the agenda slightly to accommodate the executive member, Jane Slater. So items 6 and 7 will change places. I hope that's agreeable to everybody, and we're okay with that. Item 3 is declarations of interest. If you've got any interest in any of the items, please can you let us know now. Are there any? No? Okay, item 4, questions from the public. I've not received any. Item 5 is urgent business, and again, I've not received any urgent business. So we do go now on to our main items, which, as I said before, we're going to rearrange the agenda. So it's item 7 that we're looking at, and we'll go back to 6 when we've finished item 7. This is the Ofsted update, and this item we have in attendance Councillor Hynes, who is the Executive Member for Children's Services, and Jill McGregor, Corporate Director for Children's Services. And I'll pass over to Councillor Hynes and Jill McGregor.
Thanks very much, Chair. So we wanted to bring this report to Pandemic Scrutiny tonight because as part of the usual arrangements, we were providing regular reports actually to the Children's Scrutiny Committee on the progress of Ofsted, and we felt that it was incredibly important really that we did provide people with an update and give members an opportunity to ask us some questions. And I will in a couple of minutes just hand over to Jill to talk you through all of that. But I guess I did want to really recognise that since the last time we provided an update, there has been an incredible amount of work on our improvement journey. And I think what you'll find is that there has been a lot of progress. And that is in no small part due to the immense commitment of all of our staff really, and from the council as a whole, I think, who have tried very much to wrap around support for children's services. But what you'll also find, I think, is that there is still a lot to do on that journey. And you know, there is a lot of work that is ongoing, which Jill will touch on in a few moments. But I think we do have to recognise as well that we have been through, or are still going through, some incredibly significant challenges, which I think everybody will recognise with COVID and what that has meant. It has presented, as people would expect, some challenges in terms of our improvement journey, and we've very much tried to align our improvement journey with the priorities that we've had to set really for dealing with the pandemic. And I think we've talked to this committee in the past really about lots of those challenges really, and how children's social care in general has been impacted by the pandemic, how we've had some really big significant worries about some of our vulnerable families and how we keep in touch with them, and we have absolutely made all attempts really to ensure that we can keep in touch with our vulnerable families and children. But obviously things are very different in the world that we're in. So there has been an impact on that improvement journey. But that is not to say that we are not, as committed as we have always been to making the improvements that are required. And with that, I will hand over to Jill. Thank you.
Thank you.
Thank you for that introduction, Councillor Hynes, and apologies for it being a lengthy report, and in addition we've provided a set of slides. It felt really important though to give a degree of detail, because as Councillor Hynes has articulated and indicated, it has been a while since we've formally presented at Scrutiny, and obviously the arrangements that we're working in at the moment mean that it's a different set of scrutiny arrangements. So with that in mind, I did take the liberty to remind committee members of some of the findings and some of the issues that were identified in what feels an incredibly long time ago, really. And from a chronological point of view, it is quite a while ago, but obviously there have been a number of events, not least the circumstances that we're working in, that have impacted on that. I think it's fair to say that broadly speaking, the findings were about the leadership and the management of the service, and what those leaders and managers actually understood about the quality of practice on the front line and what they were doing to support that. And so a number of things that we have needed to do have had to get to the heart of that. So we have needed to strengthen our management arrangements, and that's not just through the provision of posts, but actually really thinking about what our role is, what we need to do, and how we are helpful to our practitioners, because nobody comes to work to do a bad job. And I think one of the things that was so challenging for the inspection and the findings was that recognition that ultimately it meant we weren't getting things right consistently for our children and our families in the borough. And that was something that I think the service and the council felt very keenly, and we've needed to acknowledge that in order to move forward. As part of that, obviously, there was a commitment to have permanent leadership arrangements in place through the recruitment of myself as a DCS, but equally to think about what we needed to support at team level, so that every team had a dedicated team leader, that they had manageable caseloads, and that they could be supported in all that they were doing. And they were things that we saw some significant success in to begin with. I think it's fair to say that as we went into the pandemic, we had ambitious plans. We had ambitious plans for how we could take the work forward, building on the success that had already happened, to really have that rapid acceleration. So we identified that we needed to further strengthen our leadership arrangements. We identified that we needed to make sure that managers at every level understood what good practice looked like, what what that meant for our children and families' lived experiences. And we absolutely recognised that we needed to move on from having plans that were about scaffolding, structural arrangements, to actually that real focus on practice. And our ambitious plans that we wanted to take forward, we had hoped to do that through a series of workshops that could be really, really inclusive, because recognising that safeguarding is a shared responsibility, recognising that we're all committed to our children and families, we wanted to do that on that basis. Unfortunately, as soon as we made those plans, we did go into lockdown. We were also due to have our monitoring visit from Ofsted at that point, and that would have been Ofsted coming in and formally assessing our progress up until that point. As we went into lockdown, Ofsted weren't able to come to us, but they had completed the prep work, as had we. So they offered us the opportunity, or we asked for rather than they offered us, the opportunity just to assess where they thought we were at. And they did absolutely acknowledge that there had been significant progress made at that point. They acknowledged that the governance and our actual quality assurance systems had been strengthened. They absolutely recognised the strength and the leadership that had been shown corporately and by the council, and they have continued to be impressed by that in terms of saying that there has been that wraparound children's services. One of the key areas that they acknowledged that had significantly improved was the front door. So our initial response when concerns are first identified, when issues are first raised, that we had invested significantly in staff, that we had much better oversight, and that we did actually have an appropriate response. They also recognised that the work we were asking our practitioners to do, our social workers to do, was now much more balanced in that they had reasonable caseloads. And that was something that the council absolutely committed to. And whilst that's broadly still the case, there are some pressures because of surges through the pandemic. What they also identified, though, was that probably one of the things that we needed to think about was how we could accelerate and really expand our improvements. And I think just that point that Councillor Hynes has made about actually when we're in a lockdown situation, when all of our services are needing to think about different ways of working, that inevitably is going to have an impact on the extent to which you can be innovative, further expand and further improve. Having said that, we have taken a very clear approach to our improvement activity. And what we have said is, if you're doing the right thing for our children and families, Ofsted and improvement takes care of itself, because actually by doing the right things, you will be improving services. In reality, what that means is we have stripped things back to basics. So even when we have been in full lockdown and as we move into tier 3, we've said the primary thing that we need to do is to be helpful to our children and families, is to visit our children and families, to talk to them about what's happening, to focus on how we can help. We've also sustained our multi-agency processes. So we've still continued to have our child protection conferences, our meetings with other professionals, and to take forward plans for our children and families. We've also done a lot of work with our partners to actually refresh our improvement plan. And at the last improvement board, we had that plan signed off. And that plan really talks about what we are already doing and what we will continue to do to strengthen our service offer, and actually how we will do that in partnership. And whilst that sounds a simple thing to do, it's absolutely right that we say, what is it that we are going to do that will make a difference to our children and families? More recently, as well as strengthening thinking about the leadership team, we have now recruited a new director for early help and children's social care. Cath retired last month, having given years of dedicated service to Trafford. We've also created a strategic lead role for practice improvement and learning, recognising that improvement and learning is a continuous process. And their specific role will be to support our staff at every level, to learn and celebrate when things go right, but to absolutely implement a model of coaching and support for our frontline practitioners. I've touched on the fact that we've already co-designed and refreshed our improvement plan. And one of the key aspects within that is how we make sure that our help is responsive and that it happens at the earliest possible stage. Early when problems start to arise, but early in children's lives. And so we're really moving at pace in terms of our redesigned locality early help offer. We've also challenged ourselves in terms of having made a number of changes, having put scaffolding in place. Do we really understand what our frontline practice looks like? Is our quality assurance framework making a difference? And actually, are we taking the learning forward from that? And to support with that, we did commission an independent consultant to do some targeted and very detailed pieces of work with our managers, and to check out what practical skills they had in terms of those QA processes. And we're now implementing a detailed plan of support around each manager at every level. We have also had our DFE progress review, and I think it's fair to say the findings of that were quite pleasing, whilst recognising that there was more to do. But critically, we recognise that we still need to strengthen some of our practice. And like I say, we're trying to break that up, as well as being ambitious for our children and families. And so at this moment in time, the way that we have broken it up is to say, in order to be supporting our families, we need to see them. We need to see our children. We need to talk to them. We need to understand what life is like for them. We need to share our information. We need to use our multi-agency meetings as the vehicle for driving forward plans. We have continued to make sure that we've got oversight of every contact and every referral at the front door, so that continues to be a strength. We have recognised that working in the pandemic is different for our practitioners, and we have issued specific guidance on how to look after our staff at such times, recognising that it's a challenging time for them as well as our families. So some of the soft touch things, you know, like how to keep in touch, how to support your staff. We absolutely have maintained our multi-agency processes, strategy meetings, child protection conferences, and core groups. We've also focused on what that means for our children in care, recognising that actually being in the situation that we're in could have an adverse impact on placement stability, but actually our placements are the places where our children in care live. They're their homes, and needing to wrap around our foster carers, our residential staff, and our children to try and make sure that we have the strength that's needed in terms of that support for our placements. We still have some more to do. We have had some instability in staffing, and we've done a detailed piece of work in terms of what that looks like. And that's identifying a number of issues. And one of those issues is that it's really, really important that we get the support right to our practitioners. We still need to make sure that we further embed our quality assurance systems so that we understand exactly what's going well, what we need to further strengthen. And we have implemented a different range of performance clinics and auditing to help with that. And that includes actually observing people in practice and seeing what they're doing when they work with our families, so as we can understand how we might strengthen that and equally celebrate what's going well. We have tried, as I've said, to phase and stage our approach to improvement, recognising that you can't do everything all at once, and that it's really important that we make it feel doable for our staff, because if we just say you've got to change everything, then probably things won't get done as robustly or as well as you would want. We are really challenging ourselves and thinking about how we organise the service in a way that is helpful, not just to our staff, but to our children and families. Because we've got some groups of services and some managers that have spans of control that they are interconnected but don't necessarily go together in the same way as you would want. So we've actually started down that path of doing something. We have continued to meet with the improvement board, and the improvement board has continued to put challenge into the service in terms of testing out whether the things that I'm saying have got better or are improving. And it's really important that we're open to that level of scrutiny and challenge, because we should not be in a position whereby people are saying, you don't know what's happening. And I think at that point, I'm probably going to pause. There is a lot more detail in the report, but I just wanted to give a flavour and an overview. And obviously, I'm happy to answer any questions.
Thanks for that quite detailed overview. Really, I think it's quite helpful for you to go through it as you have done. Right, I'll just open it up for questions. Are there any questions from members? Well, I have a few questions.
I'd have been disappointed if you didn't, Councillor Acton.
Yeah, clearly, you know, with improvement plans, and you've really touched on that, and quality assurance and so on, that you need very strong performance management of the targets that you're actually setting. And I suppose it's how we, of the Scrutiny Committee, can help in terms of that, because, you know, if we've got those clear improvement targets, you know, and we've got in place a performance management role, really, that would be helpful to look at the progress that is being made, you know, in a real way. Obviously, you know, you've set out a number of improvements that have been made, but it's how we actually, you know, sort of scrutinize that.
So just in terms of that, and it's a conversation that we've had at corporate parenting as well, isn't it, Councillor Acton? So in terms of the way that we have approached the improvement plan, and we talk about it in terms of our ambitions, under every one of those ambitions are some performance indicators, the majority of which at the moment are quantitative, but we've also included some qualitative measures. So for each of our 8 ambitions, we have a series of key indicators that should be the way that progress can be measured and challenged. And one of the things that I've put in the report is that we would like Scrutiny to invite us back on an agreed frequency, and that can include formal reporting against those performance indicators, because I think one of the things that meant that we couldn't chart our progress in quite the way that we would want to was because we hadn't tied our activity to, and how will we know if we've got there, and what will the impact be. So we've deliberately approached our refresh of the improvement plan with clear indicators against each of the different 8 ambitions. So we would be more than happy to bring some of that performance reporting back at a date in the future.
That's really helpful, Jill. I think the other thing that I kind of noted was the independent consultant to talk to the staff and you know, look at strengths and weaknesses that we may have, and how we can actually improve those. How is that actually going on the ground? How do the staff feel about it as well?
It was really interesting. The staff talked about that work, even though it wasn't anything that, if you like, our own validation or self-assessment hadn't identified. The staff and the managers that were directly part of that coaching and challenge exercise talked about it as being light bulb moments, and actually the approach of show and tell. Show me where you think you've done that. This is what I'm seeing. And that support really did help people think. So they do talk about that work by Mary Candlin. They do talk about it being challenging, but they also have her words echoing in their ears. So they're embracing that we're approaching things in a different way, that we are saying we will coach, we will support. So another example of that would be in terms of changing the performance clinic arrangements. I've had individual sessions with all of the strategic leads where I've given feedback on their performance reports that they've said and said, this is good, but it would be even better if. So I think from a changing culture point of view, and absolutely recognizing that we're all in this together and we have to learn and we have to support our staff to do it, I think they are feeling more confident about the approach. Fair to say that some people think that me wanting to have a level of detail sometimes is quite forensic. I make no apologies for that because I think it's too important. It is our children and our families' lives that we're talking about. And it was one of the things that we didn't get right. So I think it's really important that we carry on with that. So broadly speaking, most of them are welcoming it. They've embraced the learning. We're also maximising different learning opportunities. So our managers, our practitioners come together quite regularly. And actually, we're tipping the learning into those spaces and having conversations and asking them, what do you think we should do about this issue? Or does that feel right to you? So we've got much more of an approach to embracing learning, being open to what's happening and how we can improve it.
Are there any other questions from other members?
I think there's a few hands up, David.
Oh, right. I have to, yeah, I do have to go along the line. I can't see, you're not all on the screen together, you see. So I've got John Lamb and Councillor Rose Thompson.
And Geraldine as well.
Oh, and Geraldine, yeah, Cath, yeah. Okay, so we'll take those three as I've said them, and that's John Lamb first.
Okay,
John?
right. Thanks, Chair. Thanks, Jill, for the report, which was very comprehensive and clearly sets out where we are up to now. So I've got two probably basic questions, really. I was just interested to know what sorts of, thinking about the pandemic and looked after children, the children within the scope of the, the service. What sorts of issues are sort of coming forward in terms of, how they are coping or not coping in this rather difficult time? And then my second point was, if I just put my chair of governors of a secondary school hat on, I was just thinking about how well we are working with the schools. I mean, I think I know what the answer probably is, but I'd just be interested to know, is that part of the multi-agency sort of working arrangements that we have, and are we picking up those sorts of issues?
Absolutely.
So two bits there.
So if I take that second bit first, and then I'll come back to our children in care. One of the things that has been a real strengthening through the pandemic, ironically, has been our working with schools. So some of the things that we have needed to do is to make sure, particularly when we were in lockdown, that we had a rapid alert system in terms of any vulnerable children that weren't in school, and that we were having conversations with our teachers and our schools to say, you know, Jill McGregor's not in school. She is somebody that you're working with, and we're really quite worried. So as we could determine who was the best placed person to go and see that young person to share information. And that has been a real strengthening. We've also stood back up our early help panels, and the schools are very much taking information to those panels to say who they're worried about, so as we can have a collective response. And as part of our multi-agency meetings, we have been seeing who's been able to come to the meetings, what that's looked like. And again, attendance has been quite good using the virtual space, really. I touched on the early help developments, and we've actually seconded an ex-head teacher to be part of our core team to take forward those early help developments. And I think as a chair of governor, you'll know that actually teachers talking to teachers probably carries a lot more weight than a social worker talking to a teacher. And I mean that with the greatest of respect to my social work staff. But part of what we've done through the co-design and part of what we're doing in the approach is to value and recognise the expertise and the knowledge that every professional has. And teachers know our children really, really well. They see the majority of our children every day. So we need to listen to what they're saying. And I think they're finding that incredibly helpful. So one of the things that I know is that in terms of our children who have a social worker and their attendance to schools at school, it's been higher than the Northwest average, higher than the England average, and 81.5% of our children who have a social worker have been going to school. So just by having that system of conversations, agreeing whether we needed to have a multi-agency meeting, whether we needed to do a visit that week, how quickly that visit needed to happen, I think there's been a strengthening. Is there more to do? And will teachers say, we told you we were worried about this and you wouldn't accept it as a case still? Yes, there'll always be those instances. But what I do think is that we've got a much better shared understanding of what those issues are and what we need to do to take them forward. In terms of our children in care and how they've experienced the pandemic, it's looked different for different young people, and I think you would expect that. Our virtual school has put on a whole raft of supports to reach out to our children in care, and they've also extended that to children who are open to social care but might still be living with their parents. And that's enabled us to have bespoke packages and bespoke support, as well as some coming together. So for some of our children, they've actually liked working in a virtual way better. You know, when I was a social worker, which is a very long time ago, it used to be you could have some of your best conversations when you were driving your car because somebody didn't have to make eye contact with you and they didn't feel the intensity of it. So for some of our children in care, they've quite enjoyed having the contact with their social worker in different ways. But we've said, that's okay, but we still need to come and see you. One of the pieces of work that I'm absolutely delighted with, which was a coming together of children's social care and schools, was we recently commissioned a film, and we had an independent film company come in that was called Transitions, and we had 3 of our secondary schools involved in it. And it wasn't specifically about children in care, but it was about our children's lived experience during pandemic. We had a young person that had special needs and a level of disability involved in it. We had some very talented people, and we had some people for whom life was difficult involved in that piece of work. And if any of you haven't seen it, I would really encourage you to watch it. It makes me cry every time I see it. And what that was all about was capturing what this period felt like for our young people. And I think the important thing for me now is, so what are we as the adults with some responsibility going to do with some of their messages and their learning from that?
Okay.
Thank you, David. Before you go on, could I just comment on the film? Because I would agree with Jill, it's an excellent film. I passed it on to my two head teachers and said, can we get this out to our school population? Because I thought that, it clearly spoke to children, to youngsters of that age. So, no, well done. It's a great film. Thank you, Jill.
Good.
Thanks, Chair.
Councillor Rose Thompson.
Thank you, Chair. And thank you for the report. I thought it was really thorough and lots of information in there. I just want to ask about the recruitment and retention. You did some work into the issues around recruitment and retention, and I know you've put some measures in place to improve that. Are we bearing any fruit as yet, or what kind of timescales are we looking at for improvement?
In terms of that detailed piece of work, that really forensic piece of work, we only concluded it last week, and it has highlighted some themes, and we absolutely do need to take all of those recommendations forward. And one of the things that was really striking for me was that there are some underlying issues, there are some themes, and one of the things that we know is that actually how you look after people, how well they feel supported, is one of the key things. So we already had a recruitment and retention group that was meeting. We already had a detailed plan in terms of it. But now that we've got this forensic analysis, we need to refresh, update and take forward that plan. So in terms of what we've done so far, bearing in mind that it was only completed about 2 weeks ago, I've already shared the findings with Cath as lead member, because it's really important that she understands what we're saying. My leadership team have considered it. We're updating and taking the actions forward, and I'm taking it to our practitioners board in the next couple of weeks to talk to staff about this is what we're finding. And a little bit like the transitions film, the critical thing is we've got the information now. What do we need to do about it? So we need to think about how welcoming we are to our students. We need to think about how we can grow our own. We need to think about what our development opportunities are for our staff who are with us, how we build on their excitement and their enthusiasm, because different staff will have different levels of interest in various things. I hated working with adolescents because I wasn't very good at it. Whereas some people feel really enthused and do that really, really well. Some people really like adoption work and like to be able to support children to find their forever family. So we need to harness what interests people as part of their career development and aspiration. So we have a number of actions already in place, but there are some that we just really need to think about from the perspective of we've had this detailed information. So the information included analysis of exit interviews, comparing salaries with other local authorities, listening to what our staff were saying, taking the findings of the Pulse survey, age demographics. I mean, it really is an incredibly helpful piece of work. And like I say, the challenge is for us as the leaders now to listen to that work and take action.
Okay, Councillor Coggins.
Thank you.
Yeah.
Thanks. Yes, I think Councillor Lamb has asked some of my questions. Having two heads gives him a great advantage. He dives in with people. But anyway, thank you, Jill, for the report and the update, and thanks to all the staff who I know are working hard, and it's incredibly difficult and important. I wanted to ask a few questions about the caseloads. It's one of the things, I suppose, where those of us who don't have a deep understanding of social work can actually see some figures in that. I seem to remember that we had started somewhere around 30 and there was an LGA benchmark, I think around 20. And it mentions in the report that they'd improved significantly. And it mentions at one point they got to 17, but they seem to be creeping up again. And I was just wondering if we could have an update on where that is up to and how we were doing in comparison to LGA benchmarks and that. And I also just wanted to ask about, it mentions there's still capacity issues at senior leadership level. And I was wondering what that really entails, I suppose, and why that is, because obviously we have been working on that. So I was just wondering if we could have some more information. Thanks.
So in terms of caseloads, the average is still under 20, but averages are just an average. And that is the critical bit, that there is variance in terms of some teams, both across teams and within teams. So the majority of practitioners do have caseloads below 20. I do have some people that have caseloads above 20. So we're looking at that on an individual level, because the first thing we have to do is say, what's the support that that individual practitioner needs if they have a caseload that's higher than 20. We've done some work in terms of things like, is that because they haven't had the opportunity to close a case when it's safe to do so? And can we give them protected time to do that? We've also done some analysis in terms of caseloads and demand across teams, and we have had some staffing instability. So we still have additional capacity in order to support that. We are at the moment looking to temporarily increase our agency staff, recognising that we have got some turbulence and we have got some increased demand coming through. But critically, the last conversation with Councillor Thompson in terms of actually stabilising the workforce and having the right people with the right skills in place is the best way to manage the caseload issue, really. So and I think the other bit that I would say, and if any of my staff were here, they would say, it's not just about the numbers, Jill. It's about the complexity of the cases. So one of the things that we do is, as well as looking at the numbers, the average, and I take that right down to individual worker, is what the nature of their caseload is. Because if you've got 3 families that have 5 children in them, you can very quickly get up to your figure of 20. Does that mean that that's an excessive caseload if actually their circumstances are, it means that you're writing the same reports and you've got the same issues? Or actually, if it's from a 17-year-old down to a baby, you've probably got quite a diverse number. So we look at numbers of families, numbers of children. What type of work? Is it a child in need case? Is it a child protection case? Are we doing active assessments? Are we in care proceedings as well? Because there's something about matching skill. There's something about giving a balance in terms of what that work looks like for our practitioners as well. And that's one of the key functions, I think, of your team leader, your managers. You know, it shouldn't take that we get a weekly report that says what that looks like. But I do get a weekly report on caseloads, Geraldine, and I do ask those questions about, that doesn't look right, so what are we doing around that? And that's one of the things that I think my staff would say they probably feel a forensic level of scrutiny on. But again, it's really, really important to do that. In terms of the management capacity, 2 things, Geraldine. Obviously, my 2 new people that I'm recruiting to, Jude starts on Monday and Pamela starts the Monday after. So they're not physically here yet, although they have been spending some keeping in touch time. I think the bigger issue for us is that we know that for some people, when we promoted them into positions of team leader or service manager, we didn't necessarily get right this is what the task involves and this is what the expectation of you is. That actually we need to make sure that we support managers as well to learn how to be managers and what that means. So one of the things that we're working really hard on is clarifying roles and responsibility and accountability, but wrapping that around with support for managers, because you can't just say, go and do a new job and that means you know everything about it. We have to recognise that we have to help and support our managers and leaders at every stage.
Is there any more questions? No? Oh, wait a minute. Yeah, Councillor Jane Dillon.
Thanks, Councillor Acton. I just would like to say I really liked it, Jill, when you mentioned back to basics, because that's just something that I really, really think is really important and absolutely brilliant. So thank you for that. Can I just ask really quickly, because I know we're getting on for time, how are you assessing the outcomes of the children and the families, please? And that's it from me.
And I think when I said about the majority of our indicators at this moment in time are quantitative, not qualitative, it absolutely is an area that we need to further strengthen, because the ultimate test about whether what we're doing makes a difference is whether our children and families say it's worked and whether it's made a difference. So one of the things that we are starting to do is to look at how we can do things called conversational audits. And it's what it says on the tin. You go out and talk to people and say, how was that for you? What did that feel like? Did we get it right? What can we do to further strengthen? So we do have some surveys that go out, but actually we know most people don't take the time to fill out a survey, and the best way to get that immediate feedback is to have that conversation with somebody. So it's definitely an area that we're really sighted on in terms of needing to improve. But it is something that we are absolutely committed to, because that has to be the ultimate test about whether it's made a difference, not because we get an Ofsted judgment, but whether our children and families say that was a really good experience and you've been really helpful to us. We do have some services where that's already embedded in the way that they work. So, but it's something that we need to roll out across all of the service.
Okay. Councillor Coggins, you've still got your hand up. Are you fine? You should disappear for that minute.
No, sorry, that was from earlier.
All right, oh, that's okay. Right. I don't think there are any other questions. Can I thank Jill and Councillor Hynes? I think it's been really helpful. You know, having this update really, and a lot of work has been done, but there's a lot to be done as well. So I think that's recognised from everything that you've said, but it does seem to be a good level of progress that is being made. I'm not clear when the next Ofsted visit will
we should have had a monitoring visit in March, but as I said, that was
yeah,
postponed. What they've done now is they aren't implementing monitoring visits. They're undertaking what they're calling assurance visits, and those assurance visits will take the form of a focus visit, which in effect will be a 3-week inspection for us. We're due any time. I was kind of, my prediction had been that we would get it on the 2nd of November, but that would have meant we'd have got a call on Tuesday, and we didn't. So who knows, any time. So it's imminent. And the other bit that I'm really clear about and we're working on is that actually any inspection is just an external validation of what you're doing, and we're working really hard with the staff to make that a reality.
Yeah. But I think it'll be useful, obviously, once that you know, inspection happens, that we do get another report. I know it'll be reported to the council as well. To be useful for scrutiny, I think, to have a report and, you know, to update us on that visit. Okay, then. Well, can I thank you, you know, so much for coming tonight and you know, sharing that update to us. I think it's been very, very valuable. And I think the other thing that I'd like to say is, you know, to thank all the staff for all the work that they've done, particularly, you know, throughout this pandemic period, but prior to that as well. And you know, so they've worked so very hard, I believe, and you know, they deserve our thanks. So I'd like you to pass that on.
Thank you.
Right, okay then. We now move on to the public health and adult social care, which was 6, but it's become 7 item on the agenda. And this is in 3 parts, a public health, an adult social care update, and the health services. Just to say, for the health services, we do have in attendance Martin Pritchard, who is the accountable officer for the Trafford CCG, and Naomi Ledworth, director of commissioning for Trafford CCG. But that's the 3rd part, so we'll start at the public health update, and we have the executive member for health and well-being, who is Jane Slater, and the equalities, and Eleanor Roaf for Director of Public Health Services. So I don't know who's going to start. Is it Councillor Slater or?
Yeah,
Chair,
just
sorry to interrupt, Chair. Should we just also welcome Heather Fairfield?
Yeah, I meant to do that actually. Yeah. So, sorry. Yeah. I will absolutely do that. I've written it down here, and I've just missed it on my paper, so I'm really sorry about that. But yes, also a welcome to Heather Fairfield, who is the chair of the Trafford Health Watch. To this meeting, and hopefully for future meetings as well, because I think I know Heather does a lot of work in terms of and it's voluntary work in terms of keeping an eye on all health matters in Trafford, and I think that's tremendous work that she does. So I know you are there because I've seen.
Yeah, I am here. Thank you.
Yeah. So thanks very much for coming, and I'm sorry that I missed that introduction, but you are most welcome as always.
Thank you.
Right. So can we just go to the Councillor Jane Slater?
You, Chair, and no, we should never forget Heather and all.
Oh, I know.
So, and thank you. And we have been doing, quite a lot of work, obviously, in Trafford, and we've been looking, with the hospitals around how we are going to make it safe for people to be able to go and have those services that were stepped down at the beginning of COVID. So I know that Martin and Naomi will be able to give you some further information around that. Obviously, Eleanor's going to be able to give us an update of where we are around public health and what track and trace and stuff looks like currently. And you'll all be aware that, from midnight tonight, we go into tier 3. So there will be new comms around what tier 3 looks like. So, it's an ever-changing feast, and hopefully that, we're plateauing with infections across Trafford, but I'll let Eleanor give the latest information. Thank you, Chair.
Yeah, thanks, Jane. Eleanor?
Okay, thank you very much for inviting me.
Yes.
So
busy as always.
I know. So we our levels do seem to be leveling off slightly. Unfortunately, this is because our rates in our late teenagers and people in their early 20s are starting to drop. So that was that student population that we started to see very high rates in September and the middle of October. And we are now seeing an increase in our rates in our people aged 65 and over, which is obviously the group that we were most concerned about, because they are the people who are most likely to be seriously affected if they get COVID. And in fact, we are now seeing our hospitalization rates going up. I think one thing about the hospitalization rates is that the hospitalization rates are determined by the number of people who became infected or ill 2 or 3 weeks ago. So with the rates we're seeing now, we are going, as we see those rates go up, we will see the rise in hospitalizations coming forward in the next 2 or 3 weeks. So, I think when and the NHS is very well equipped and has coped and will cope, but to say that we shouldn't worry about it because we're not seeing the hospitalization rates yet,
that actually these people are, if you like, we don't know which of them will end up in hospital, but some of the people who've been infected over the last couple of weeks will end up in hospital over the next couple of weeks. So we really do need to be doing absolutely everything we can to try and get the rates down in this older population. And because most people over 65 live absolutely fit and healthy lives, living in the community and so on, we can't get the rates down in that population unless we also get the rates down in the rest of the population. Very sadly, we've seen a couple of outbreaks recently in care homes. We've done incredibly well more recently in keeping cases out of care homes. But I think with the levels of COVID that we have in our general population, we will really struggle to keep that out of the care homes, because however hard those care home workers try and however much the care home managers work, if you're, when you're coming into work from a household where there are other people of all ages, you really will struggle with that. So the other issues that we have in Trafford, remaining issues, as you know, we still continue to see these very high rates across the board. Our highest rates are currently in Clifford Ward and Hale Barnes. And I think that just tells you everything you need to know about COVID in Trafford. It is absolutely everywhere. There's very little that those two wards, if you they're not our most deprived and our most affluent, but they're nearly. So it is that difference that we're seeing. And we have rates over 400 per 100,000 in all four Trafford localities. So we really are seeing very widespread. Only two wards with rates of less than 200 per 100,000. So this is something that we need to be dealing with as a borough, as Trafford. This is absolutely all of us that it is affecting. I'm not going to go through the detail, the report in detail, and I'm very happy to take any questions. But on the testing, we have still seeing some issues with delayed results, but we seem to have much better access at the moment. We are a bit concerned that the rate of people going for testing is dropping, and we're slightly worried that this is because of publicity about the link with the police being given test and trace data. And this is something that I think from a public health perspective, I would be very concerned about sharing that data. I think it's most important that we get that engagement with our population and they have the trust in us to come and have a test if they're symptomatic. Our positivity rate remains high and isn't decreasing. So that suggests that it's not that we're seeing fewer people being tested because we have fewer cases. So that is a worry for us. Our contact tracing is working well locally, but again, the national issues with the testing and the delays in the contact tracing are still problematic. And I think the national contact tracing, they do make an awful lot of calls to people. I was talking to somebody the other day who, through her household, they had had 42 calls from Test and Trace over that 2-week period. I mean, that would try the patience of a saint, to be honest. So I think there's some things we need to be talking to the national system about how we improve that. Locally, we pick up the cases when the national system hasn't been able to contact them. In many cases, they are completely uncontactable, but we are getting through to people that the national system hasn't been able to reach. So we are doing well on that. And a lot of our time at the moment is being spent through the contact tracing work on working with schools and other settings such as businesses to support particularly the schools and the head teachers in identifying who need, if there's a case in the school, whether a bubble needs to be suspended and so on. We've had, in the main, our cases in schools have been community acquired and we're not seeing a lot of transmission within the school. But one piece of learning that we've had from workplace settings and from our school space work is, and if there's one message that I would really love it if everybody on this call could take home and spread to everybody they know, which is if you have symptoms and you have a test, you must stay at home until you have the results of that test. Your family must also stay at home until those results come in. Because if you go back to work or if you go to school while you're waiting for the results, then if you get a positive test, everybody that you've seen that day when you were waiting is going to be, if you've come into close contact with them, all of those people will have to self-isolate and none of those people will be happy with you. So please
please, if you are waiting for a test, please do not go anywhere. Just stay at home with your family for that time. The second issue I think that people have got, and I think both are confusing, but the second issue is if you found somebody in your family has a test and you're told to self-isolate, then it's no point you going for a test unless a doctor tells you to if you don't have symptoms. If you don't have symptoms, the test result may well come back negative, but that you still have to self-isolate because you could be incubating the disease. So again, it's just that message about, please, if maintain that self-isolation, because that's the way to break the transmission. Because the thing with this is you're infectious before you know you've got it. So the only way we can stop that is getting in early and helping people isolate. And I suppose the final thing I want to talk to links to that, which is the community engagement work. And that's the next big piece of work that we're going to be trying to do in Trafford. We've got people going around in North Trafford tomorrow, talking to particularly mosque leaders. We've got translated materials, but also into shops and businesses, just trying to make sure that everybody has that message. We'll be doing similar work in the other localities, because obviously we do have these high rates across the board. And most of our transmission, we suspect, is just people generally mixing with other people, going out in groups. I think sometimes as well, when people hear about household mixing, they think it means your whole household mixing with another whole household. But of course, if you live in a house with 4 or 5 people, and each one of you may go out with different groups of people, and so you can quite quickly get a very wide spread if one of you is infected, just because you're seeing more people and between you. So we're really pushing that. Obviously with Tier 3, there's more limitation on what people can do, but it's actually, we're really trying to push the message about, absolutely get some exercise, see people, but do it outside, go for a walk in a park, keep those 2 meters distance, and really do not go into anyone's house, do not invite anyone into your house. So I think that's what I wanted to update. I think you may have heard lots of that already. But...
No, thanks very much, Eleanor. Now I'll open it up for questions now, and I do have Councillor Dr. Karen Barclay and Councillor Barry Winstanley. So Karen.
Thank you, Chair, and thank you, Eleanor, so much for that very helpful presentation. I just have 2 questions. The first one is about the issue of fines and the police getting involved. I mean, I think that is a very damaging message, and I think you acknowledge that yourself. And I just wondered, what can we do kind of as a borough to counteract that? Because I do fear that people won't come forward. I mean, I read that nationally it may be accounting for the fact that the number of young people, particularly students, are not coming forward because of that concern. So how can we counterbalance that? Because that is such a dangerous development. And the other point I'd just like to have some clarification on, please, is last time we met, we did hear that there might be some movement towards a more locally based contact tracing system, which we know would be incredibly helpful and probably engage a lot more people, and we'd find more cases, more contacts. Do you know how far plans for that have developed, and how well equipped are we to do that should it become implemented? Thank you.
Okay, so I'll start with the fines, and I completely agree with you. I think my understanding of the legislation around the fines with the contact tracing is it's up for local areas to implement that. So I don't know what we can do with the national part of it, but I think certainly from speaking to colleagues in Greater Manchester, I haven't heard anyone who has any appetite to start introducing that in Greater Manchester. So I would not be wanting to share our local data with the police, because I just think it makes it very, very difficult to get the trust of the population. Not that I think there will definitely be cases where we will issue fines, but those will be in much more, I would suspect them likely to be in, if you like, quite outlier cases, and perhaps with businesses where we find, I mean, with the businesses, we have had to close some businesses, issue directions to close businesses because of non-compliance. So I think, but really, I mean, in this country, we police by consent, don't we? And when we've got the rates of infection that we're seeing, we all need to be thinking about how we change our behaviour and trying to enforce it when it's about households and how households behave is really, you're on a hiding to nothing. We need to work with our communities so that they can understand what it is we're trying to do, why we're trying to do it, and most importantly, how can we support people if they have to self-isolate, and how can we support people so that their mental health and physical health remains good through what is going to be, I think, a very difficult winter. And threatening people isn't going to help get that engagement. We have to get that engagement through conversation, through discussion, through negotiation. On the locally based contact tracing, there are greater plans for Greater Manchester, and as we're now in Tier 3, there is additional funding that will be coming through into Greater Manchester to support with that. So that's the £8 a head that you may have heard about. So we're looking at what we need to be doing locally around contact tracing and how that builds into the Greater Manchester approach. But the other thing I would say is, with the rates we've got at the moment, we're not going to contact trace our way out of this at the moment. We're seeing over 110 people on average a day testing positive. We can't possibly, if you think of each of those people, if they're being honest with us about how many contacts they've had, particularly when people are working and so on, you know, that can be up to 30 people. We cannot contact trace all of those people without an absolute army of contact tracers, and it's just not an efficient way of working. What we need to do is sort it out at the source and help get that prevention in to make sure that all of our businesses, all of our workplaces, and all of our population are understanding how to be COVID safe. And that's the message we've got to get through to people, that people have some control over this themselves.
Can I just follow up on that, Eleanor? Because I think obviously there's been a lot talked about testing and tracing. There's been a kind of panacea of getting out of this, and what you're saying tonight is that that's not the case. It's impossible. So I think you know that what I've been hearing on the news quite a lot is that if we get good test and track, then you know, we won't need to have all the kind of lockdowns that we're experiencing.
Well, the trouble is that you'd have to test and track so many people if you think that to do it effectively, where it works is where you've got a low rate in your general population, and then you can quickly get on top of any infection and isolate it from everyone else. But when you've got 300 people per 100,000 testing positive, when you've got 110 people every day coming forward every day who are positive, and then you have to isolate all of those households, etc., you quite quickly get to a situation where you don't actually have a workforce anymore, because if you're doing it all by test and trace, people are all self-isolating and so on. And this is what we've seen. Some of the cases we've seen in schools is because we're having to close down whole bubbles and classes. And that means the teachers and their families are then isolating, or the children are isolating, and that means parents have to stay at home looking after their children. And I'm sure there are people on this call who've been in that situation one way or another. And so, you know, you quite quickly get to a situation where actually it's not going to be the way forward. Whereas if we can, I mean, public health person, I'm going to say prevention is better than cure. If we can make sure that people take the steps they need to make themselves safer, and that we work with our businesses and our workplaces and our schools, which we have been doing fantastic work in schools and businesses to make them COVID secure, then we're much less likely to have the outbreaks. So what we need to do is get the rates down. Once the rates are down, really quick access to testing to anyone who's positive, really quick contact tracing of those people. You know, if you've got a 4-day delay in getting your test results, by the time you've got those test results, the people that you might have infected before you knew you were ill, in those 2 days before you even went for the test because you didn't know you were ill, those people are starting to develop symptoms and may have infected somebody else. So, you know, unless you get those tests done really quickly and you get the contact tracing done really quickly, it's not going to work, and it won't work on big numbers. So
I think it's interesting how you spelt it out, because it's not necessarily the message that is getting through to the public, you know, and it seems to be that is a national, you know, if we get a world-class test and track, then, you know, that'll solve all the problems. But it's not, you know, and I quite understand why it's not. But I think it's useful just to have it spelled out. Yeah. Okay. Who else have we got? I've written it down somewhere and I've lost it. Oh yeah. Councillor Barry Winstanley.
Yeah, thank you, Chair, and thank you, Eleanor, for that crystal clear report. And I couldn't agree more with the point about fining people. Yeah, anyone who's ever managed anybody knows the best way you get the best out of people by working with them. Continually kicking them is the wrong way to do. Is the wrong way to do anything. I'd like just to return to the tracking bit of the report, because I read that with some horror that the national data is not in any way, shape or form robust. And I assume that the national data is coming out of the euphemistically called NHS system, which is in fact the Serco system, the one we spend 12 billion quid on. It is that system which is not producing the right set of data, isn't it? And I was just horrified to see that we're having to put local resource into data mining to make sure that that data is in any way, shape or form usable, particularly in the context where we're being denied funds for Greater Manchester, we're being denied funds for the funds to feed our kids. To spend £12 billion on a system which doesn't work strikes me as just absolutely monstrous. But however, the question leading up to is when you're dealing with the Serco teams or whoever you're dealing with to look at this data, what are their reactions when you tell them that the data is not fit for purpose? Because I assume they're the kind of contractual conversations that you will have. So that was a long build-up, but what we back was a quite straightforward question. Sorry about that.
So we don't have the contractual arrangements, obviously, with either the testing organisations or the national NHS test and trace. Those are both nationally commissioned services. So but what we do is where we have issues with the testing service or with so for example, we will often report back to the HSC if we have issues with care homes not getting the tests they need. So we make sure that where there are issues, we report them back in. Those are being reported as well, repeatedly up through Public Health England and through other colleagues. So those reports do get in, but they're not our contracts. So we don't actually have any ability to renegotiate them. In terms of the test and trace, I think the national system, I think some of the inefficiencies are the fact that they could, if they didn't keep needing to ring people so many times, they could probably ring more people. And I do feel quite sorry for them, because of course the bad press that they've got has meant that people have lost faith in it and people aren't speaking to them. And in a way, some of that isn't their fault. Certainly it's not the fault of the people doing the phone calls. So my main urging is for people to if you are contacted by NHS test and trace, please do engage with them. Please do self-isolate. Please do take it seriously, because it's really important and they are just doing their job. We get the data through and we will follow up, and we would like to do that more quickly. And I do think, obviously, in a local area, you do know your local areas and you're able to engage more easily with people. If somebody says to me, oh, I live in Sale, or oh, I live in Hale, or I live in Purswood or whatever, I know immediately what that means, don't I? But if I was in a call centre in Warrington, not even Warrington, Essex, say, I wouldn't know what that meant, and I wouldn't maybe make those links. So I think it is that we just need to make sure that whatever we do and how we're doing it now, we build better and we get a better system so that we're able to get that data through quickly and we're able to contact people quickly. And at the moment, I really feel that we need to be, for all the frustrations with the national system, it's better that we try and support it, because it's a really important part of the system. And the more trust we get in the whole system, the more likely it is we'll get all of this under control.
Thank you. Thanks.
Okay, I think that's it for questions for now. Can I thank you, Eleanor, for all the work that you and your staff do. I say it every time, but I really do mean it. But thank you for that update. It's been very helpful.
Thank you. Thank you.
Can we just move on to adult social care? And we have Councillor Harding, the Executive Member for Adult Social Care, and Diane Eaton, who is the Corporate Director of Adult Services.
Thanks, Chair.
Joanne, yeah,
Yep.
there you are. Yeah.
Thanks, Chair. I'm going to bring Diane in to talk through the detail of the winter plan, because I think it's important, obviously, as Diane, as our Director of Adult Social Services, to talk through some of the operational detail. But I think I just wanted to pick up on a couple of points that Eleanor mentioned and referenced specifically around some of the infection rates in care homes. That is something that obviously I will be keeping a watching eye on, and in close contact with Diane and her team. Clearly, it's something that we've been keeping an eye on since the start of the pandemic, and we were very proud at the beginning that we made sure that we had all the testing in place. But as things have changed and we are going into a second wave, and staff potentially being asymptomatic, and issues with test results coming back and so on, we are sadly starting to see some of those positive results. So I just want you to be aware that as a pandemic scrutiny committee, always happy to come back and feed information on what the care home sector is looking like. And it's really important that we keep an eye over the winter period. I guess the other thing I would raise about adult social care and care homes in particular, and not just for older people, is that you will all be aware of the restrictions around visits. And some families have not seen their families for months and months. And this is an ongoing issue. And as we move into Tier 3, those restrictions are still in place around visits. I'm working really closely with the Alzheimer's Society, with Diane and her team, and with North West ADAS. And across Greater Manchester, there's been an options appraisal paper written so that we can try and look at some ways that we can try and see if we can facilitate visits in a very safe way, potentially looking at testing, the use of PPE. So that's also being raised at a national as well as a regional level. So those are some of the key areas around adult social care. But again, just to remind you that the visits, that also looks at younger people who are potentially in supported living with learning disability, people with mental health issues. So it isn't just older people in care homes, it does cross a range of people really. So I'll hand over to Diane to talk through the winter plan. But as always, I'm very happy to take any questions on the issues I've raised too. Thanks, Chair.
Thank you, Joanne.
Thank you, Chair. I'm not going to put the presentation up, Chair, because I know that obviously time is an issue. But I'm just going to pick out some points from the slides for the committee to consider. On slide 3, you'll see some modelling. So we've been doing a massive amount of work looking at the first wave and then the differences with the second wave of the COVID virus. On the first wave, we had people who were considerably older who were affected, had numerous long-term conditions, and their journey into hospital and their length of stay in hospital was considerably long, so 10 to 12 weeks on average. So when people were ready to go home, the services they need were quite different from the phase that we're going into. So we've got a lot of younger people who will recover a lot faster and will need to go home with home support. So we've been remodelling all of the both bed-based and support at home that we require. On slide 4, it sets out all the guidance and the legislation that's been issued and the requirements to complete an adult social care winter plan and an NHS Wave 3 response plan, which includes all of the step up of business as usual, elective surgery, etc., which Martin's on and we'll speak to later. We've agreed for Trafford we'll have one plan because it's too confusing to have more than one. So we'll have one collective integrated plan as we always would do. On the further slides on slide 5, it sets out some of the challenges. Winter is always a complex time for adult social care and for our health colleagues, just because of the sheer demand, weather, slips and falls, flus, etc. However, with COVID as that added overarching concern this winter, we are planning for a long and difficult time. So part of our approach on slide 6, taking account of all of the phase 3 work, which is the business as usual and restarts of elective work, the winter capacity planning that we would normally do anyway, and the surge planning based on what we've seen from the COVID infection trajectories.
We've then brought that across on slide 7 into adult social care and looking at how we then also look at aspects of preventing the spread of the virus in our care settings. And I'd include not just care homes, but people living at home, particularly where they have vulnerabilities, and how we work as a system across health and social care and with our partners in the voluntary sector and other services to collaborate to make sure that we've got the right support in place going into the winter period. We've worked really hard with our colleagues in the hospitals to ensure that we can facilitate the right capacity and community to help people go home quickly should they need to go into hospital, or more importantly, if they don't need to go in, how we support them at home to remain as well as possible and get the right medical support as well as social care input. On slide 8, our Trafford local care organisation response is detailed there for you. They've been tracking their capacity in district nursing and therapy support, in our social work provision as well. And each of the pathways that we have developed are attached as a separate document for you to see, and it breaks down how the journey of support is put together across health and social care, and then the services we have in place to respond to that. We have a whole programme of work set up to deliver these changes, and we refresh the requirements based on intelligence that we receive on a weekly and daily basis back through Eleanor's team and other sources. We've worked very closely with MFT looking at the actual activity in each of our hospital sites and then how we need to respond going forward. The hospital discharge policies that we've been running since the beginning of COVID based on the changed legislation have been updated because the legislation and guidance changed in August, with a funding change from the 1st of September. So from that date, anybody leaving hospital is funded by the NHS for a 6-week period, after which they move to the long-term funding for any care. We've done all of that work together, and we've actually set some of national trends on how people will work in the future across health and social care around assessment. We've commissioned numbers of discharge to assess beds, which are temporary beds in our care homes, which support people who just need a little bit more recovery time before they go home. We've done masses of work with the homes and with our providers to make sure that any infection risks are managed really carefully. So we are very, very clear that people leaving hospital are tested before they leave hospital. They have temperature tests for 48 hours prior to leaving, and they have to be below a certain level before we'll accept them into our care homes. You will know recently that we went out to tender to look for some beds for people who were COVID positive on discharge from hospital, and we are currently negotiating with Manchester around a specific provider. CQC have introduced a inspection requirement for those types of homes, and once we have commissioned that service, we will submit to CQC, and that inspection will take place alongside Manchester. We're also commissioning additional rapid discharge support to support people in their own homes, and that process is underway. And our colleagues in health around therapy and nursing support are also increasing capacity in the areas that the modelling indicates we need it. Obviously, there are some key risks over the winter period, not just the risks that I've talked about on the normal winter, but all of the increased infection activity and responses that we're needed to make. Our supply to homes for things like PPE, which you will have heard a lot in the press, we have very good supply. We track through our commissioning team twice a week with every provider to check that they have supplies of everything, that they have no other issues that we need to support them with. And we also talk about their long-term requirements for support. We have a couple of areas that we're exploring with colleagues across in the CCG, which is the support for people who have got long-term impacts post-COVID. You will have heard of long COVID on the news being referred to. That's the sort of long-term breathing or mobility issues that it tends to leave people with. And that work is progressing. We haven't sourced all of the services we would like yet, but we are working across Greater Manchester and nationally around some of those responses. One of the biggest concerns for me, I think, is people that do not seek medical help quickly enough and therefore enter our services at a much later point than they would have done. And there's a lot of work being done with Eleanor's teams and with our colleagues across health and social care to get those messages out to people The early indication of any medical situation is much preferred for your own health, but also to ensure that we can manage the support quickly and effectively. We've got some great examples of work that our care providers have done. We've got oximeters in care homes, so people are able to take oxygen checks from people and liaise with primary care. We've got enhanced clinical care support into all our care homes, make sure that people are well supported. The winter plan itself is around 50 pages long, but this is a summary and hopefully will give you an overview of the work that we're doing to ensure that the residents of Trafford are supported well through the winter. Thank you, Chair. Thanks
very much, Diane. I think that was a pretty good run through of what you're doing. Is there any questions from members? No questions? Well, I think you must have covered everything pretty well, to be honest.
Thank you. Thank you. If there are any questions, if people let me know.
Yeah, we definitely will do that. But thank you, and I really do think, because obviously every day is a different day at the moment, isn't it? And I think trying to keep the pandemic out of the homes is critical and crucial. And I think you look as though you're doing everything that you possibly can to avoid that. We're really grateful for that update.
Yeah, can I just add something, Chair?
Yeah.
I've seen something circulating on social media again from Amnesty International today that mentions about a leaked report around positive tests and care homes, which I know we've had this discussion before around the Channel 4 news piece. I just wanted again to reassure the committee that that we do have those testing processes in place, but I do think it's important to reiterate that there will be people who test positive who still need the support of social care services. So we need to be really clear about that we have a statutory duty of care to provide care who will be positive with COVID. So we have to be careful not to demonise people who test positive too, and make sure that we don't set the hairs running amongst people who might have to place their family in a care setting. So we're managing that very, very carefully. We're trying to make sure the messaging is very sensitive about that. But if any of you do see those reports and are concerned, we are very transparent and open about how we manage that, and we'd much prefer you to come directly to us and ask those questions rather than set up, all the panic that happened last time. Thank you.
Yeah, no, thanks for that, Joanne. I think it's a really good point that you make, and it is a statutory duty, and we've got to do the best that we can for every individual within the care homes, and I think that's exactly what we're trying to do. Yeah. So I'd like to thank all the staff and all the care homes really for all the work that they have been doing through this pandemic. So if you now go on to the health services. We've got for this item, as I said earlier on, Martin Pritchard and the accountable officer for the Trafford CCG, and Naomi Ledwith, Director of Commissioning for Trafford. And you've been very, for Trafford CCG, and you've been very patient, but I'm really pleased that you've come along today. I don't know who's going to help to go through this update.
So, Chair, if it's okay if I start,
yeah.
And then I'm going to...
That would be great, Martin.
Thank you. And thanks for inviting me here this evening. It's been a while since I've been to Scrutiny with these new arrangements. So, first of all, I'd just like to say how well I feel that Diane and Eleanor have worked to support the health service in Trafford. And it's absolutely been a real partnership between health and social care all the way through this, and continues to be. I think, David, Chair, sorry, you said that every day is a different day. Sometimes it feels like it's the same day repeating itself. There is a bit of an element of Groundhog Day with this at the moment, but absolutely, we've been absolutely joined together all the way through this, and I'm sure we will be, however long it takes to get through this. So you've asked us to talk about the health service response in this. In a moment, I'm going to hand over to my colleague, Naomi, who's going to do this. What I've found from all the other times that I've been to Scrutiny, if we do a very short presentation, and then we can answer your questions and focus in on the areas that you absolutely want to focus in on. So I'm going to hand over to Naomi, and then we're both here to answer all of your questions. Thank you, Chair.
Excellent. Thanks very much, Martin.
Thank you. So just on that, I'll follow suit with Diane and maybe not put my slides up, but take you through the points of the slides, because I think Martin's point is correct. It's we're giving you a very high level overview of what the services the CCG Commissions has done in response to COVID. And I'm sure that will stimulate some more questions, which we can either answer tonight or we can take offline and come back to you as well. So the first bit is around general practice and what has happened within general practice. So in the initial phases of COVID, we worked with the practices to make sure they were all prepared. It's, you know, the priority here is to ensure that we sustain the workforce, make sure that we've got the doctors and nurses and healthcare practitioners to be able to support people to stay well, but also to give access to people in a safe way. So the initial phases were to work to ensure that every practice was able to respond and were prepared. We took steps initially right at the start of COVID to introduce a total triage model, which very much changed how everybody has accessed GPs. I'm sure most of us around here have probably been to a GP during the pandemic, and initial triage is non-face-to-face, and then that determines whether people need to come into surgery or can be dealt with over the phone. There has been a real move within Trafford, which actually happened before the pandemic, around digitalisation as well. So the use of Ask My GP and giving people alternative ways of being able to contact their GP at any hour of the day, really, to be honest. Which has made a difference. We've supplied IT support to the GPs to ensure that they could work from home. Just going back to the case we were talking about before, you know, if you're socially isolating, or if you've been contacted by track and trace, we don't want to take out the workforce in that case. So we supplied additional IT equipment to enable that to happen. And set up dedicated clinics for those patients that are described with as hot, or those that are described with having COVID symptoms, that being that they could come into a dedicated hot service or be visited at home if they couldn't get into the service as well. Goes without saying, there was a robust plan around PPE supplies to ensure that we kept our workforce protected. And also we took a very flexible approach to how the GP contract was laid out, and allowed GPs to flex the services they have and the capacity they have to meet the demand, rather than what was really stipulated, you know, per day, per hour within the contract. We also had a suite of priority pathways, and that's probably a demonstration of how closely we work with Diane and Eleanor, because Diane's mentioned that within her presentation. So the GPs weren't just working alone, they were working with their partners across the system, the discharge to assess pathways, the virtual wards, end of life support within care homes, and urgent care provision as well. So there was wraparound services to support the GPs. And access to testing. We also redeployed our own staff, stepped down some of the services we were working on to go and support and keep frontline services running within the GP practices. So moving on to this next phase of recovery, we're very much looking at how the networks, how GPs can work together to be resilient, particularly as we're now testing wider and workforce fluctuations may happen. We have a winter plan which integrates directly into the winter plan that Diane was talking about, which covers the flu vaccination programme, which Eleanor will know much more about than I do. And also we're managing normal service is being put in place in light of lessons learned from COVID. So for example, having one practice to look after one care home rather than multiple practices to look after a care home. Just moving on then to mental health. The majority of mental health services stayed operational during COVID. They may have changed how they worked, and they may have changed in the timings of being able to access, but they did stay open. The the mental health providers are working with us to make sure that they are planning for the increased demand and expected complexity that will come as a result of COVID and the impact that that has on our population. And also, there are some very specialist pieces of work around mental health. So the providers across Manchester and wider are working together in a mutual aid approach to make sure that they can support each other should there be constraints within an individual provider. There's been a real focus on care in the community rather than inpatient care, because the safest place for someone is within their own home rather than a ward where we could spread more COVID around. So there's been a focus of moving the services to be able to provide that care within home. Crisis response at the front door to be able to give that crisis response and try to prevent people being admitted into hospital. And also a helpline, a 24/7 helpline to recognise that there may be some low-grade issues that people would want to contact and get into the health service through that way as well. In terms of hospital recovery, so what we call the elective programme, which is just basically planned operations, was, it was very publicly known that was stepped down right at the start of the pandemic to enable the hospitals to respond to the growing demand. Since then, the focus has been on recovery. So we have lots of system groups and working groups with MFT, who is our main provider, looking at how we can recover and stand up elective and diagnostic and cancer activity. This is through basically just standing the services back up, but also by using new and innovative ways of working. So much more digital access, having advice and guidance lines for GPs to be able to contact rather than referring patients in, and also clinical validation. So working and speaking to patients to understand if they actually still want the operation, it's still needed, where they're at, how severe they are, and how we can support them. There is a really big challenge though, so the waits are longer. We're looking at 52 people waiting over 52 weeks to be around the 6,000 mark by March, which is a very huge number. But we are working with the provider to be able to validate that, work with the patients to understand how we could manage it in different ways. But it is a legacy of COVID that we do have longer waits than we had before. In terms of urgent care, the activity significantly reduced during COVID and during the lockdown period, but it's actually now increasing back up to pre-pandemic levels, which, as we hit a second wave, is having an impact on the ability of the hospitals to be able to respond. So again, there's lots of work going on to think about how can we give people who really need access to urgent care that access, but prevent queuing within waiting rooms and do similar to how the GPs have worked. So we have digital access through 111 and what we're calling a local clinical assessment service, which will hear and treat and see and treat patients digitally, and we'll be able to book them into services. So the urgent care services that we would have had previously, where you wouldn't have been able to book into, we can go through those services and book into them, which means that people don't have to then wait in waiting rooms. They have allocated slots, and it's much safer for the staff and the patients as well. And then I just got lost in my slide there rather than going on to the next one. In terms of community, it links very much to what Diane was mentioning before. There was a step down of the community services again in line with national requirements to mobilise the first COVID response. But since then, they have been stepping back up services, focusing greatly on the work that Diane's been supporting around discharge to assess and therapy within the community. And also providing access to equipment as well, because we've seen an increased need for therapy in post-COVID as well. So, and also the community services are also focusing on how they can do online digital access as well. So I'll stop there, pause, see what questions you want to ask, and I think Martin and I will probably do a bit of a double act on the answers back on those.
Great stuff. Thank you very much for that introduction, really. And I think the fact that we received this, before the meeting, and it's very simple to actually read. And I think there are so many issues in there, and having it very simply, in a simple format like that, is very beneficial for us because obviously we get a lot to read, and I think it's when you get something simple, it's easier for your own mind to sort of register all the issues that there are. So thanks very much for that, much appreciated. Councillor Rose Thompson.
Thank you, Chair. Can I ask a question about the mental health recovery and the mental health urgent care centres mentioned in your slides? I don't believe these are operational at the moment, are they? But what are the plans to start up these emergency urgent care centres, and what will it look like, please?
So I don't think as a patient it will look very much different than what we have now. It's just about making sure people are aware and understand that this access is here. So they will be co-located within A&E departments or urgent care departments, and it's effectively whenever someone makes contact or turns up at these centres, there's a triage or a streaming at the front end to identify need, and then it will be streaming the patients directly into those services. Kind of traditionally, you would have maybe sat in A&E for a bit to wait for the mental health team to come down to see you. This is more about kind of front ending, about streaming and being able to get you there quicker. So it's not really new, it's just a different, it's lessons learned from COVID, really. It's a different way of doing what we've always had, really, and hopefully making that better. But I think it's about people understanding that those access points are there as well. So we are starting to do publicity and comms now across the system. You will see it over the next month or so, and it will be national as well, to let people know that there are these places that they can go to seek help.
Thank you. Councillor Dr. Karen Bartley. Karen?
Thank you, Chairman. Could I just ask about using the Nightingale Hospital that we have within well, not within the borough, but within Greater Manchester? What is the likelihood of using that either for treating COVID patients and therefore freeing up the hospitals, or for using it to treat COVID patients so that the hospitals have their own space back again? Thank you.
You want me to answer that, Martin? Is that okay?
I think I can safely say, Naomi, you know much more about the Nightingale than I did, having been involved setting it up in the first place.
Yes.
I think so, can I just add to that, really?
Yeah.
That question, and I'll try, roll it up in one, really. Are you going to cope in the hospitals? Because
yes.
of the pressures that it looks as though it's going to come under in a couple of weeks or so.
Yeah, so I'll do that second part as well. So yes, there are plans to reopen the Nightingale to be a resource just for the initial period for Manchester and Trafford. It will be a 36-bedded unit, and it will be predominantly for COVID negative patients who will be stepping down, who need more rehab therapy and support. So as Martin alluded to, I helped set the Nightingale up in the first wave of it, and it was very much the more acute patients who were needing oxygen and CPAP and more intensive care. This is looking about supporting patients because we know the demographic is going to be people needing longer rehab and support, so if we can move them to a safe place that they can get that support, that frees up the hospital capacity. So I think the short answer to the second part of the question, Chair, is that the hospitals will cope. But they're having to flex and adapt their plans very regularly. I go to the MFT strategic meeting 3 times a week and hear that happening live. And also the hospitals are working together across GM in what we call a mutual aid approach. So they have done modelling about the impact. So Eleanor described the lag period from whenever you test positive to whenever there might be hospitalisation needed. So the peak is expected in the second week of November. It's going to be slightly larger than the initial modelling, but the hospitals are now flexing their plans to ensure that there are enough beds converted to manage COVID positive patients and ICU as well. There may be a need to look at triggers of when elective care activity may step down again, but only for a short period of time. But again, they're managing that at a GM level. so that we're not causing health inequalities. So it's busy. There is a need to do things differently, but they have clear plans and a clear understanding about how they're going to manage.
Okay. Is there any other questions? We are getting on a bit in time, so if there's no other questions, can I just ask Heather Fairfield from Health Watch if she wants to say a few words, and I'll come back to Martin and Naomi.
Yeah, thank you, Chair. As you probably know, we have already published an interim report on our findings around COVID. And literally while I've been on this call, the draft of the final report has come through to me. There are perhaps one or two things that will be of interest to the committee. The first one, which was a little bit of a surprise in one way, but not in another, was that last year we had 45,000 hits on our website during the whole year. In 6 months this year, we've had 75,000 hits. So not quite double, but very, very significantly more. And I think what this does is it backs up the need for the public to have a very clear communication, really. There was an issue about that the largest reason not to access services was the feeling that this wasn't necessary. And I think that perhaps links into some of the comments that were made earlier. But clear communication was felt to be the most important way that information could be improved. In terms of the feedback on the website we've had, most people wanted to know about test and trace and the new 119 number, whether people could get a free NHS test today to check if you have coronavirus. And I think we've seen that on the TV as well. And then general information and news stories that were asked for. In terms of Youth Watch Trafford, this was quite interesting. Young people wanted to know at what age you could visit their GP alone. They wanted to know about the mental health hubs. And again, I think that reflects back on what's been said. They wanted information on young parenting as well. And they also wanted information on going back to school and what they should do. So we've come up with about 7 main findings, and we've come up with an equal number really of recommendations. And I hope that you'll have the full report with you in a short space of time. The other information that was sent through to you was some of the free text comments that we'd had. Some were surprising, some were quite predictable, really. Some were quite worrying, but I think that people generally are under a great deal of stress, and I think sometimes people find that hard to articulate as well. So I hope the report will be of value, and thanks for the opportunity to talk to you about it.
Oh, that's great. I mean, I haven't seen the draft report, so it is something that I believe that the committee would want to have a look at and analyse, and it'd be helpful, obviously, for you to put your perspective on it all. I think you've given us a flavour of it tonight, but yeah, that would be really useful. Can I just say to Naomi and Martin, can I thank you for coming tonight, and for all the work that you and all the staff you both are doing, and all the staff are doing and have done throughout this pandemic. It's absolutely, brilliant work. And, I think, everybody in the country, is hailing the NHS and all the workers, and we're no different. Doing a fantastic job. And Heather, you are as well, doing a brilliant job within the community. And there's people like you that keeps it all going. And I think, we can't thank you enough, really, for all the work that you do.
Yeah.
So I think they're all the items on the agenda in terms of what questions that we wanted to ask and so on. And so I'm going to close that part, but I'll keep open the members, because we just want to do a little bit of a roundup on issues. So can I thank all the people who've come along tonight, the members and the officers, and the CCG. It's much appreciated in public health. And I think the one thing that has come over to me through all of it, and I know it has been mentioned before, that the partnership working is absolutely brilliant, and to me it feels as though it's seamless, and I think everybody's working together, tirelessly, but also excellently. So thank you very much for all that you do, all the members and officers. So you can toddle off now. Go in the kitchen or downstairs or wherever you're travelling to today. But thanks again. Cheers.
Chair.
Can the other members just remain, because we've got a couple of hours to.
Thank you, Chair.
Yeah. Okay. Thanks. Right. Yeah, we've just got another item to deal with, and that's items for future meetings. So I think we do have an agenda setting panel, which 4 of us sit on, myself and Denise Weston and John Lamb and Karen Bartlett, and we usually meet the next day, so that would be tomorrow. I don't. Is that still on, Alex? I don't know whether we're doing it. Is Alex around? No. Or John Addison?
Yes, I'm still here. Sorry.
Oh, yeah.
I've not set one up for tomorrow, as it is Friday tomorrow, but
yeah.
I'll set one up for your nearest availability.
All right. So if we can meet, maybe I don't know whether John, and Denise, and Karen will be listening in. Is it the executive on Monday? We could tag it onto that.
Yes, it's the executive on Monday.
So we could tag it on to that, couldn't we? 6 o'clock. Yeah.
Yes, I'd be happy with that.
Yeah. That. Okay. So we can do that. Yeah, because we'll need. We've got the. I think the next meeting is in November the 20-something. So we'll need to have some items in relation to that. I think one of the, obviously what Heather said in terms of the report that she's she's developed and is in draft form. If that's ready, that would be quite a useful item to look at if we could get that early, and we could analyse what so some of the people in Trafford are doing in terms of their health and well-being, and what they're actually saying. So I think that would be helpful.
David.
Yeah.
Sorry, I think maybe an update on the school situation by then as well, given that you know, they're increasingly being impacted, particularly as the level of community infections are increasing. I think, I don't know if you've already discussed it when you were looking at it earlier, but
no, we didn't really do that. We were looking at the Ofsted, so we didn't really touch on that.
Maybe school attendance and things like that, you know, how schools are keeping going.
Yeah.
That will be really starting to bite, I think, by November.
Yeah. Is there anything that anybody wants to say? I mean, obviously, we you know, the agenda panel will, you know, look at the items, but I think it's been a long time, hasn't it? We're a bit over time, but we did start 10 minutes late. So you can feed into us anyway. You know, members can feed into us, and then we'll set an agenda for the next meeting. And I think, as far as I know, the scrutiny for budget, there are two meeting dates set aside, the 1st and the 3rd. They still stand, are they, Alex?
Yes, still going ahead with the 1st and the 3rd of December.
Yeah, so you know, there will be, you know, quite, well, there'll be 3 meetings in close succession, really. So we just need to bear in mind that when we set the agenda for next time. Okay, well, I think you're all tired out now, so I think, I know I've got on the agenda the exclusion resolution, but we don't need that. And I think all the agendas have been dealt with. So can I thank you all for your attendance and for the questions, and have a nice evening this evening.
Thank you, Chairman.
Bye, everybody. Yeah.
Bye.
Bye. Bye.